Hey everyone, welcome back to the show. I'm your host, Dr. Joseph Kappas, and today I'm joined by my guest, Dr. Lauren Brindisi. Thank you for joining me today.
Hi, thanks so much for having me.
You're welcome. Dr. Lauren, you are currently working out of Carolina Functional Neurology, right?
Yep, Carolina Functional Neurology Center.
Yep. And where are your locations?
So we have two locations. One is located in Raleigh, North Carolina, and the other is located right outside Charlotte in Huntersville, North Carolina.
Excellent. Yeah, I love North Carolina. So.
Yeah, it's beautiful here.
Mm-hmm. So today, Dr. Brindisi, you wanted to talk about the difference between dizziness and vertigo, right? And how those link to anxiety.
Yes.
Yeah. So these may seem like dizziness and vertigo. Some people probably just lump those two together, but they're not always the same thing. And then anxiety kind of sounds like an oddball when you put the three together, but I'm sure we're going to talk about why they're all very important and why they're related.
Yeah.
Mm-hmm. So just a little bit of background on yourself. Why did you get into the field of functional neurology and chiropractic?
Yeah, great question. So in undergrad, I studied neuroscience. I became really, really passionate about learning about the brain, about understanding some of the more progressive research out there about neuroplasticity. And that really tumbled me into, looking at what type of career options I could create out of that. My sister, Dr. Dana Brindisi, who runs the Raleigh office, she went to chiropractic school and did introduce me to functional neurology. So prior to that, I thought I was going to go get a PhD in neuroscience, and she really opened my eyes to my options to be able to use up-to-date clinical neuroscience, but in a rehab, in a patient-centered way, instead of doing basic research. And that really excited me because I love working with people. I love helping people. And it's allowed me to combine two of my passions together. So that's kind of where all that started. I also was introduced to chiropractic when I was pretty young. I was adjusted when I was 14. And I remember I had a back injury. I got wheelchaired into the office and I walked out after one adjustment. So that always was an idea in the back of my brain when I knew I wanted to go some science, healthcare type route. Mm-hmm. So when I started undergrad, I actually thought I was going to go to chiropractic school. But it wasn't, then I kind of veered a different route as I started studying neuroscience, and I felt so honored that I could really, kind of pull those two together. And so I went to chiropractic school knowing I was going to study functional neurology.
Yeah, and you were able to combine the best of both worlds there, and that's fantastic.
Yeah, it's definitely fun.
Yeah, and I really like.
Yeah.
Oh, sorry.
I was going to say, to be able to help people and be able to utilize, recent neuroscience research and apply that to treatment is
right.
I mean, it never gets old. It's so fun.
Exactly. And when you can just read a new paper and say, this applies to XYZ patient, and you can actually then, like you said, apply it and, help them in real time.
Yeah. So, yeah. And so that's, a big part of the reason that I wanted to spend some time here talking about dizziness, vertigo, and anxiety, and the links between the two of them, because there is some really interesting information out there about that. And I know that there are a ton of people dealing with all of those symptoms and maybe haven't kind of put the pieces together as to how they're related.
Yeah. Yeah. Which I'm sure there's a lot of people who aren't sure of the connection. So before we dive too deeply into that, can you define the difference between dizziness and vertigo? A lot of times people use them interchangeably.
They do. So often we see, like you said, people use them interchangeably, and there's some overlap, right? So usually dizziness is more of a general term. that explains a variety of symptoms people may have, right? They may feel off balance, they may feel lightheaded, they may feel swimmy headed. I feel like often people kind of just clump all of those symptoms into dizziness. They may have vertigo, whereas vertigo is very distinct, in which they may feel like the room is spinning or they're spinning themselves, which there's overlap in the two, but usually with this, when people say dizziness, we always have to dig a little bit deeper into the understanding of what dizziness really means to somebody. It's a lot more subjective than someone having vertigo and saying, I feel like the room is spinning or I'm
Hmm.
spinning.
Right. And maybe you can touch on, you don't have to go in too much depth, but maybe you can touch on maybe some of the causes of maybe vertigo versus some of the causes of general dizziness.
Yeah, so with vertigo, one of the most common causes would be BPPV, or benign paroxysmal positional vertigo, which is a peripheral vestibular disorder in which the inner ear is affected and the fluid in the ear gets affected, and that creates a very distinct type of vertigo in which they may tip their head back, and then 10 seconds later they feel like the room is spinning. There's other types of vertigo, which we'll delve into a bit deeper when there's more central consequences of vertigo, but they feel like they're spinning or the room is spinning, versus dizziness, where they may feel like they're bobbing, or they feel like they're kind of swaying side to side, or they may feel lightheaded, in which we see those types of symptoms often after concussions. We see that with different types of dysautonomias where patients aren't regulating their autonomic system. We can also see those types of generalized dizziness in different types of metabolic disorders, right? So we see patients with gut issues that can create dizziness, or patients with anemias might have feelings of dizziness. So you have to dig a little bit deeper. I feel like when someone says they have general dizziness, in terms of what does that really mean, versus vertigo, which is, I am spinning. And we often look at those peripheral mechanisms first, and then we may delve a little deeper into the intricacies of the vestibular system.
Right. Yeah. So dizziness is such a broad category. So like you said, you really have to dive deep. Um, so what are some of the consequences that a patient might experience from like a prolonged dizziness?
Yeah, so in this case, I kind of do want to clump the two together because they're often related to dysfunction of the vestibular system.
Hmm.
And often chronic dizziness and vertigo is very scary for people, right? Usually people jump to, rightfully so, some conclusions that something very significant, possibly life-threatening, may be going on with them if they're having dizziness or vertigo. So I apologize about that.
Okay.
um, so what can happen for patients, right? And it's something that we see every day clinically, so I know you understand, is we use neuroplasticity to our benefit, right? To help people build stronger, newer, more stable pathways in their brain. But when people deal with chronic, unresolved dizziness and vertigo, there's often a negative consequence to that neuroplasticity, in which their brain starts to adapt to that. So when we see maybe some of these sensory mismatches where they're not getting accurate information from their vestibular system, the brain does a couple of things. It might start to dampen that input to say, I know that that's not correct, and I want to pay attention to all the other systems that I think are giving me correct information. Or it might kind of wax and wane for them. So what I often see for patients with either chronic dizziness or chronic vertigo that's gone unresolved is it's like a cycle for them. So they may, try a different therapy, or eat a little bit better, or work on their stress management, and they may see it get better. But if we haven't really found the root cause, they may have a stressful situation. They may get in an accident, they may be exposed to some other type of illness that all of a sudden the dizziness or the vertigo comes back, and it's kind of cyclical for them. So often at that point, what's really important is that we start diving deeper into some of these central mechanisms of the vestibular system and other areas of the brain that feed into the vestibular system, so that we can see what kind of central consequences may have been affected by a dizziness or vertigo that's been unresolved. The brain may adapt to that over time. And now we've created maybe a different type of issue that's still creating the dizziness and vertigo they've had for years.
And when you say central consequences, what might that look like in certain patients?
So what we often see when we analyze them, right, we're going to analyze their balance centers. Which is, we want to look at information from their joints and muscles. We want to look at information coming from their ear from their vestibular system. We also want to look at their autonomic system. We want to look at their eye movement centers. We want to analyze even components of their higher cognitive functions and see, do we see abnormalities in these areas that are linked to the vestibular system? And that may give us some more information that it's a possibility there was some neuroplastic changes due to an initial incident that now has created some dysfunction centrally inside the brain versus maybe just coming from the inner ear, like we talked about with the BPPV, like a common peripheral issue has now created a central issue.
Mm-hmm. And how would you say that dizziness relates to anxiety then?
So, couple theories here that I want to touch on. Most people are somewhat familiar with the psychosomatic theory, in which a patient may have a psychiatric condition that actually creates physical symptoms. So most people in some capacity are familiar with panic attacks. You may have a panic attack, right? And that may be due to a stressful event in your life that starts creating physical symptoms for you. You have trouble breathing, your heart rate increases, you start sweating. Even, that happens for people, right? You have to do a presentation at school or something like that. That can create these physical symptoms just because you're so nervous about giving the presentation itself. What people don't talk about as often is the somatopsychic theory, in which an incident such as, say, sudden vertigo from a BPPV, or we see patients who have vestibular neuritis due to an infection, and all of a sudden they were super stable and healthy, they got the flu, and now all of a sudden they're so dizzy. Well, that creates, right, like I kind of touched on before, is a lot of times that can happen suddenly, and that can be very scary, right? People may think that something severe or life-threatening is happening, and now all of a sudden what the brain does, and sometimes I feel like for people it happens in an instant, now they've just linked this overwhelming feeling of anxiety with their vertigo or their dizziness. And then that can linger for people. So you get this very strong limbic response to the incident, and now they're like hardwired together. And so we may see people who have had chronic dizziness or vertigo who now have anxiety. Some of the research shows patients that come in with dizziness or vertigo are like 5 to 15 times more likely to present with anxiety than the general population. So analyzing it from these angles, I think, is really important, because we may see patients years after they've dealt with their initial vertigo or dizziness event. And now it becomes a vicious cycle for them, right? They have cyclical vertigo or cyclical dizziness that's linked to anxiety. So they get stressed or they get anxious about something, and now they get dizzy again. And then it's trying to really pinpoint, right, where is this coming from? I often have patients come in who say, I went to another provider, they told me it was just anxiety. It was just anxiety, but I know it wasn't. I felt fine, then I was dizzy, and now I'm anxious. And I think analyzing all of those categories and trying to peel back the layers is so important, because often, right, if we can really pinpoint the timeline and hear what the patient's saying, we can tackle this from many angles, right? It may be that we can fix their dizziness, fix their vertigo, and their anxiety just goes away.
Yeah.
We may fix their dizziness, fix their vertigo, and now they're still left with anxiety. So I think it's a huge component of our rehab and our care plan for patients is to actually address the anxiety component, because that's feeding right back. It's just this loop where your thoughts are feeding into a system that's now linked together, and you need to pull them apart.
Right. And I think we talked in the beginning about dizziness being this broad kind of category of potential symptoms and causes. And it sounds like anxiety is kind of in the same boat, where there's multiple things that can, like anxiety for me may not be anxiety for you. What's causing my anxiety may not be causing your anxiety. So you mentioned the somatopsychic component, or the body causing the psychiatric type of condition in the anxiety. So just to reiterate, yeah, if you don't correct dizziness in a patient, that anxiety may just continue in a vicious cycle. So you have to break that.
Exactly. And I always say to patients, your thoughts are a motor output, just like moving your hand is a motor output. So your thoughts change your brain. And again, this is where day to day we get to use neuroplasticity to our benefit. But often we see patients as a consequence of neuroplasticity not working to their benefit.
Yeah.
And to be able to unwind that.
And with the relationship between anxiety and dizziness, you said that dizzy patients are 5 to 6 times more likely to become anxious or to have anxiety.
Yeah,
so,
I have a study that said 5 up to 15 times more.
15 times. Wow.
Yeah, general public.
Okay. So to that effect, would the reverse be true? And would you recommend that, say all anxiety patients get their vestibular systems checked?
Yes, definitely. I think a huge component for anybody dealing with any of these symptoms is to recognize that there is a link, and that there are things that can be done, right? And there's other systems we can look at too that may be playing a role. The brain's all about efficiency, right? The brain wants to expend the least amount of energy doing the task at hand. And for a lot of people, and I see this even for patients that come just with general anxiety, that we see minor abnormalities in these other systems, like their vestibular system, like their eye movements, like their autonomic system. And these are all really foundational components to the brain. So when we can get these more foundational aspects of our brain working well and working as efficiently as possible, that frees up energy for our higher cognitive aspects of our brain to thrive, right? And it allows us to live and love our lives in a humanistic way, like we all want to, right? People don't want to feel anxious. They want to feel excited and get out of that fight or flight type mode and feel more relaxed. And I think it's really important for patients who have anxiety, who are likely working with a therapist, continue with the talk therapy, but we can also analyze your brain from a clinical neuroscience perspective, in which we analyze the function of your brain. That's where the anxiety is coming from in the first place. Right. So I think it's huge. I think it's a huge area to continue for us to explore in our ability and what we can do to help these patients who do have anxiety.
And if I say, for example, I'm a patient or somebody just listening to this podcast right now, and I'm someone who does have anxiety, and listen to this, it makes a lot of sense for me, and I decide to pursue the kind of clinical neuroscience as a route to help me get better, and I decide to come to your clinic. What would I expect when I come to your clinic as far as the assessment goes and that sort of thing?
Yeah, great question. So we always offer a complimentary 15-minute phone consult for patients. We want to do a screening ourselves, right? Get a little bit of information about them. We often see patients traveling from all over. So we want to understand a little bit and see if we think they're a good candidate for care. If that's the case, when they come in for the initial exam, we run a variety of diagnostics that look and evaluate the function of their brain. So all these systems we've been talking about, we want to get a close look at how they're functioning. We run a complete physical and neurological exam. We also run a complete metabolic panel on all of our patients. So just like we talked about at the beginning, right, dizziness can be coming from gut. Can be coming from things like anemias. There's a lot of different components, as well as, right, our gut function and our physiology feed into our brain function. So we want to take a look at all of these areas so we can very specifically pinpoint for each patient where the areas of dysfunction may be, and then what's the best route or treatment method that's the most effective for them. So 2 patients that come in with anxiety, their treatment plan may not look the same at all, because just like you touched on, Dr. Joe, is that what is anxiety to one person may not be to the next person. And that's the same for dizziness. That's the same for headaches, migraines, concussions, you name it. We want to really customize that care plan for each person.
Yeah, and I think that's one thing that sets this particular profession apart, and that's one of the reasons I really love being a part of this profession, is because we do take such an individualized approach to each patient, and I think people appreciate that.
Yeah, I agree. And it's so fun to get to spend, most of our treatment is one-on-one. Any type of therapy that we do, we get to spend the time with the people and really get to know them and treat them for the person and the brain that they are, not the diagnosis they may have.
Right, which is an important distinction to make.
Yeah.
So outside of seeking care in your office, what are some tips that you may have for those suffering with either dizziness or anxiety?
So a couple things. One that really stands out to me, being in North Carolina, we have the mountains right here, which are so beautiful, and fall's coming. People love to be able to drive through the mountains, but often, when they have dizziness or vertigo, that becomes very challenging for them to do. So I usually encourage, if they're stable enough and they feel comfortable, being the driver can be very helpful. Also, when you're in the car, if you are the passenger, you can try to fixate on a stationary point that's really, really far away from you. That can help kind of change your reference point and make it a little bit easier to spend time in the car. Other components is really working on that autonomic system, right? Often when people get dizzy, they get these feelings of, they might be sweaty, they might get nauseous, they might have an increased heart rate. There's some simple things that you can try and do to activate your parasympathetic nervous system to see if that can help kind of calm some of those things down. Our balance centers, our primary balance centers, live really close to our parasympathetic nervous system. So I often suggest, and of course, if tipping your head back makes you feel dizzy, you don't do this, but gargling can be useful. Humming or deep ohms can help activate that vagus nerve. I also suggest even as simple as drinking some water or swishing some water around in your mouth, maybe enough activation to the nerves in your mouth that fire right back into that parasympathetic system. We often also work with patients with, we do some diaphragmatic type breathing, where they may be breathing in through their nose for a count of 3, and then pushing it all out their mouth for a count of 6. That allows them, instead of that hyperventilative type breathing where it's short and shallow, we're allowing them the opportunity to stretch their diaphragm, but also to push out more of that CO2 that tends to build up, and it gives them and allows them more opportunity to get more oxygen in.
And I think these tips and suggestions kind of hit on the multifactorial aspect of anxiety and dizziness, because some things are kind of addressing the parasympathetic nervous system, some are addressing the way we breathe, some we've talked about dizziness. So it really is to someone's benefit to get all of these things looked at and make sure that each factor is working appropriately.
Exactly. And if you look at that, right? So all of those things I just said, I may give to someone who's dizzy, but I may give to someone who has anxiety who's not dizzy,
Mm-hmm.
because all of these symptoms are so intricately tied together,
Mm-hmm.
and they play a role in allowing them all to function properly.
Mm-hmm. So, Dr. Brindisi, we are just about out of time. So I wanted to make sure that we left enough time here at the end of the show for you to clear up anything that we may have missed to talk about today.
No, I think that's great. I do, again, yeah, I think it's really important. If you are dealing with symptoms and it does feel like the things we're saying resonate with you, that reaching out to a functional neurologist, someone who studies clinical neuroscience, is so important. Like I said, we always offer a complimentary consult. We're happy to talk to you and see if there's any way that we can help. You can check out our website. That's carolinafnc.com. And there's an option to fill out that consult, and we'd be happy to help in any way.
It's fantastic. Well, I want to thank you again for being on today. I thought this was a really great episode, and I think a lot of people are going to have a much better idea of the difference between dizziness and vertigo, as well as the relationship between anxiety. I think we really nailed that home today.
Yeah. Thank you so much for having me.
It's my pleasure. Well, from your host at the Neuro Wellness Podcast, be well.